Hello, I am Kevin Anderson.
And I'm Adam Okada.
And we are clinical educators and hosts of the Ask the Educator Podcast, brought to you by Healthmark, a Getting a company.
Are you a sterile processing technician, infection preventionist, or biomedical engineer? No matter your role, if you're involved in medical device processing, this podcast is for you. Our goal is to equip you with the knowledge and tools for excellence in medical device processing.
Now let's get started. Hey everyone, welcome back to the Ask the Educator Podcast. This is your host, Kevin Anderson, and joining me as usual, my co-host, Adam Okada. And for this episode, which we aim to publish for SP Week, we have a very special guest from the healthcare sterilization, HSPA. What does it stand for, Arlene? Help me out.
Healthcare Sterile Processing Association.
There we go. For some reason, it just did not roll off the tongue today. So I apologize for that. I know I had Damien's voice in my ear saying not HSPA, So I was
it's
trying
not HISPA.
Yeah,
you're not allowed to say HISPA, and I've said it twice now. So Damien's going to find me for each one of them.
That's right. So Arlene, thank you for joining us on the show. We appreciate you spending your time with us and doing this special edition of the podcast.
Well, thank you guys for having me. It's a great opportunity. We are on the cusp of Sterile Processing Week here coming up in October. So thank our staff, praise our staff. They give 365 days a year, blood, sweat, and tears for our patients and patient safety. It's kind of sad that we only get that 1 week, right? I wish it was more. But it's really a great time to showcase what we do in our service and allow people to come in and kind of put eyes and boots on the ground as to what sterile processing is all about.
Yeah, well, we couldn't agree more, and that's why we're excited to do this podcast with you. One thing that I think is a really cool opportunity for us during this week is to share some stories if we have them at the top of our mind here. I wanted to see, Arlene, obviously you've been in the industry for a very long time now, and I'm just curious, what kind of stories might you have of any technicians that go above and beyond the call of duty? I know sometimes people stay over their shift and tackle mountains of backlog trays or things like that. That kind of stuff happens all the time. But I'm curious what stands out to you in your experience so that we can kind of honor some of those technicians that are going above and beyond.
Well, we have technicians, who are going to take a project and run with it, right? We have technicians who come up with PI projects for, they're tired of the way the trays are sitting in the sterile room, and now they've come up with a process to switch that out. It's those people who kind of take the initiative to, I don't like this process, but I'm going to come with solutions. People who kind of look for things that, hey, this is out of the ordinary. Let me just mention it. Staff who find outdated products is huge for me. We outdated products in our service. So when you bring me an outdated product, that is worthy of candy. Things like that we try to kind of highlight, not just during this week, but every week and every month in our service. People who are kind of just going outside of their job description, right? Not saying it's sorry, that's not my job. That is my job. I'll make it my job, and I'll finish whatever you need. You find a tray. You need me to find a tray? Let me help you find a tray. You need me to bring you a tray? I'm on my way. Those are the people we really want to highlight in Sterile Processing Week who do it because they don't need the thank you. They do it because it's for the betterment of the mission.
Yeah, and I think that one thing that you mentioned it when you were talking in the intro, that we wish there was more than 1 week a year where we could recognize sterile processing technicians, because they do. I mean, let's be honest, they work for minimal pay and benefits. They do a very difficult job, which is physically, mentally, and emotionally exhausting. And they really don't get the recognition they deserve. So do you have any ideas about when it is time to recognize the heroes in the sterile processing department? What can we do to kind of give them the kudos and the props that they deserve?
I love to do an open house where it's powered by the frontline technicians. They get to move throughout different stations. throughout the day and have different departments walk through our department and see kind of where their instrumentation is processed at, how it's processed, kind of what the staff has to go through. Having the staff stand at a table in the lobby and say, hey, did you know there was a sterile processing department here? And have instrument trays out that people can see, because people don't think about that, right? When you go to have surgery, what's going on in the background. And a lot of people don't know that where sterile processing is in facilities. We are becoming a little more well-known these days, but for far too long, sterile processing was a department within a department. You couldn't find a sign from the hallway that said, hey, sterile processing's this way. So we want to kind of get out and about in our facilities, right? And say, hey, this is what we do. We have licenses. We have certifications. Like Sharon Golden said, your hairdresser has a license. Your meat cutter has a license. Well, so doesn't sterile processing. And the attention to detail we need to have for sterile processing, I don't think people understand that either. We roughly need to know about 6,000 instruments just arbitrarily, and keep that relevant in our mind when we're assembling trays. So I think those are the things that I want my staff to talk about during sterile processing week, when they're out and about with other departments throughout, healthcare that really don't have an idea of what we do, but they sure know what we do when we don't do what we do. Right? When they don't have their instruments or when they can't locate a tray, they certainly are ready to call sterile processing very quickly, aren't they? So what a great opportunity to bring in our customers, if you will, to show them what we do best.
Yeah, I couldn't agree more, Arlene. And obviously, you touched on a few things that are going to kind of cross over into my next question. But before we do that, I wanted to share a couple things, some ideas maybe that might be a little bit different than the typical CS week thing. I know it's very common for people to provide lunches or things like that during the CS week. And I think that's fantastic. I always appreciated a free meal, I'll tell you that. But one thing I think is a pretty cool opportunity that I would like to see more departments consider doing. And obviously, this is more of kind of on the side of the leadership, right? So this might be a manager's position or whatever, but frontline technicians could help with this. And that is to simply put like a year in review type of short slide deck together showing exactly what sterile processing has been working on, what projects, what successes, what near misses, and what the ideas are to improve in the future, and how they're going about trying to increase their service to the OR, and put that presentation together and give just 15 minutes of a presentation to the OR, to their customers in the OR during CS week. And that's just one. Obviously, it would be nice to, bring some people down and kind of show them through. We talk about doing stuff like that during orientations and whatever. New nurse, new scrub tech, bring them down to sterile processing. But maybe we could do more stuff like that during SP week. But I really like the idea of doing presentations, like just short ones, not really crazy, but high level. Showcase what things have been going on, stuff like that, successes, and really talk up the department. I think that goes a really long way. I think one of the problems is that our departments, like you said, it's a department within a department, but I went my whole OR career without ever having to step foot in sterile processing, right? I just sent my case cart down the elevator, and then a new one would come up from the elevator. You know what I mean? Yeah. There were people from sterile processing that came up and interfaced with us, which was great, but I didn't know what they did and how difficult the job was. So I think it's really important that we share that with them. Now, moving on to kind of the next question, and you touched on some of this too. The reality is, I have a son who just turned 18, and he was getting a job, his first real job at Lowe's. Okay. Mm-hmm. And the reality is there's really no distinction between a job at Lowe's versus a job in sterile processing. Like the requirements are the same. And you and I know, and our audience knows, that shouldn't be the case, right? Like my son's orientation was to watch for a couple days. He watched some videos, some basic training videos, and then he was out on the floor. And I swear, like his second shift or third shift, he was by himself. You know what I mean?
Yeah.
And that would never happen in sterile processing, at least in an appropriate orientation, right? But we have more regulatory oversight. We have huge advances in technology. We have huge risks with bloodborne pathogens, all of these things. So why do you think sterile processing professionals don't get the respect that they deserve from leadership and the healthcare system in general? It's obviously a multifaceted thing, but I'm just curious what your thoughts are on this.
Well, I feel like for a very long time, sterile processing was, allied service type of thing. It wasn't considered a specialty. We were the dishwashers downstairs. And that's why it wasn't looked at as a profession. Like nursing is a profession, being a doctor is a profession, being a hygienist is a profession. But there is not a lot of professional people didn't look at sterile processing as a profession. Really, COVID kind of thrust us into the limelight. With reprocessing masks and things of that nature, it really, really brought some great exposure to the sterile processing profession as a whole. We are small but mighty. There's about 100,000 CRCSTs on the planet. That's saying something. We are masters of our craft. There's not a lot of folks out there that do sterile processing. It is very much an on-the-job training. You have to have some experience somewhere to be able to stay and sustain this career. Because it's ever changing, right? IFUs change. Instrumentation gets a lot more technical, a lot more advanced, and we have to be able to roll with those changes, right? With the industry demand. I mean, look at robotics. 20 years ago, we weren't looking at robotics. We weren't even talking about robotics. But here, they're an everyday occurrence in our career, and we have to keep, our staff educated, ourselves educated. But it's crazy how far we have come in a short amount of time in sterile processing as far as our advancements for, instrumentation, total joint sets. I mean, it is astonishing how quickly instruments are put on the market these days.
The industry has evolved over time, right? And I do a presentation called The Science and Evolution of Sterile Processing, where the whole presentation is about what we used to do 50 years ago in sterile processing, and then how it's changed today, all of the science and all of the tech that's in our departments. And yet it's not like they increase staffing. It's not like they're doing fewer cases now. It's just the demands on a sterile processing tech are so much greater. So I really think that this is one of those things where we need to take, and your idea is perfect, and Kevin kind of piggybacked off it as well. We need to take what sterile processing does and how technical it really is, and take it to the C-suite, take it to hospital leadership, so that they can understand and see, hey, these people need help. They need tools. They need resources. They need, financial allotment to sterile processing, all of those things. And until that we can convince them of how this, the evolution of our industry, we're never going to see that change from an entry-level position, unfortunately. And it should. Kevin, you made that point. Like, it really should not be an entry-level position anymore. So
just because of the requirements that we need, we need our hours are practical, just like any other profession. I don't even know when I was entry level that I had it in a year. I couldn't speak my process in a year. I couldn't speak it in 5. By 5, I was getting pretty good. I'd had a lot of events occur, so I could, bring the department back from it. But I could swear to you, I didn't know my process or be able to speak it year one, beginning in the industry. And I really depended on my coworkers, the veterans, to kind of show me. share their knowledge. And what happens when you get somebody who won't share their knowledge? They're just here for the check, right? What do we do then? How do we keep that person motivated, keep coming back to work and knowing that, you're trying to train your replacement over here. Share your knowledge with them.
Right. That tribal knowledge and the gatekeeper of knowledge and all those things. So I completely understand and agree with you there. There are too many of those for sure. But any final thoughts you want to leave the listeners with on, just anything having to do with celebrating sterile processing and understanding just how important it is?
I just want to wish everybody an amazing sterile processing week. I wish you plenty of wonderful meals, sweets, cupcakes, candies, appreciation, thank yous. Take an opportunity to go to your C-suite and say, hey, sterile processing week, did you know? Put a sign outside the cafeteria. Put a balloon on it. Hey, it's sterile processing week. So I can't wait to see the pictures from sterile processing week, because we really are getting good at what we do when it comes to sterile processing week. We have a lot of options for games we can play. Just keep it interesting for staff, right? Make ask the leadership, just what's one of your hobbies, and have the frontline staff try to guess who the leadership person is. Put it out like a raffle. So things like that to just keep it interesting and just break up the monotony. But keep remembering, you all have a purpose. We all do it for the betterment of our patients, and what you do is so important.
Thank you, Arlene. Yeah, I love all the ideas you were sharing. I really actually liked a little bit of like the quiz or sort of the game where you're trying to guess hobbies or, traits of certain people. Yeah. Of leaders. I could see. Yeah. Yeah. And I could see that going the other way too, where you involve maybe some of the OR and they have to guess the sterile processing technician or something like that. Where you kind of get these teams to know a little bit more about each other. But great ideas. Thank you again for joining us on the show. I'm going to try and get this right real quick. Arlene Bush, president of the Healthcare Sterile Processing Association. There we go. I got it right this time. There we go. See,
I'm president-elect.
Yeah, president-elect. That's right. Thank you for the correction there. So, and that means
I don't want to steal any thunder.
Yeah, and that means, Arlene, right? Correct me if I'm wrong. That means your presidency actually starts next year, right?
Correct. I take my presidency at conference 2025.
There we go. Okay.
Chucky, I can't wait.
Yeah. So president-elect Arlene Bush. All right. So thank you for joining us on this show. And this show is meant to come out during SP week. So we appreciate all of you technicians out there listening, infection preventionists, those of you out there who support sterile processing and learn about it and, can see the major role that this industry plays in healthcare and getting safe surgeries done every single day. We just want to shout out to you this week, and we really appreciate you. So thank you so much. All opinions expressed on this episode are those of the presenters. This podcast is for informational purposes only.
Before using any medical device, it's important to review the manufacturer's instructions for use and consult with a professional.
For any questions or feedback, please reach out to us at asktheeducator@hmark.com.